And turning now to something new that I learned today, there's Botox, and apparently there's something called fauxtox, and that fake kind of Botox is becoming more and more common and bringing with it all kinds of problems, trouble breathing, blurry vision, slurred speech. So how does someone tell the difference between Botox and fauxtox? Well, of course, we check with our NBC News medical fellow, Dr. Akshay Syal. Doctor, thank you so much for joining us. Botox, what is the difference between real Botox and the fake stuff?
Yeah, it can be quite scary, Gotti. So essentially what's happened in the past couple weeks or so is that we're learning that people who have been getting Botox from really what we think are med spas, Gotti, really like unauthorized places are getting really scary symptoms. They're getting things like double vision and droopy eyelids and trouble breathing. So we actually have a list here for people out there who are concerned, should I still be getting my Botox? The answer is yes. If you are getting it from a licensed professional, it is still safe to get your Botox. But if you are worried or if you do want to double check what you're getting, we do have a list here that we can show you, and really it comes down to sort of just checking the label. Some things you want to look for, first of all, make sure the label is in English. Secondly, you can look out for a lot or vial number here, C3709C3. Make sure that the ingredient is saying botulinum toxin type A, and make sure that it doesn't indicate a 150 unit dose, because the company that makes the FDA-approved Botox guide doesn't even make that dose. The FDA thinks that using these things here, you should be in good shape, and always make sure that the person is licensed.
And I'm not an expert on this, but Botox is like a face muscle paralyzer, right? What happens after you get Botox versus what happens after you get fauxtox?
Yeah, so normal reactions from Botox can be things like, injection site reactions, like you could have a little pain or bruising at the site. But Gotti, this fauxtox, because it's, we think that it is Botox in different dose amounts, for example, can cause things like blurred vision, droopy eyelids, you can be tired. Some people have ended up in the ICU, actually, for difficulty breathing and also constipation and dry mouth. But to answer your question, Gotti, this Botox works by essentially blocking nerve signals. And if you give Botox in the wrong dose, you worry about nerve signals and muscles being blocked that shouldn't be blocked, leading to that host of side effects you can see on your screen there.
And Doc, I got to admit, I was trying to read up on this before you came on, but then I got totally rabbit-holed into Botox and fauxtox in the armpits. Why?
I had a friend who used to do this, Gotti, actually. There's a condition called hyperhidrosis, which means you sweat too much, and it can be embarrassing. So people actually use Botox in the armpits for that reason. It can block the nerve signals that lead you to stop sweating. Some people with migraines even can use this, Gotti, to block the signals that, sort of block the neurotransmitters for headaches. So it's not just people using it for facial wrinkles or forehead wrinkles. There are other use cases for this, all of which should be using those tips that we gave to make sure they're getting the real stuff and not the fauxtox.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.